Did you know that a common virus often linked to cervical cancer could also be a hidden risk factor for heart disease? Stay tuned to uncover the surprising connection between HPV and cardiovascular health. Human papillomavirus, or HPV, is a common virus most often associated with its potential to cause cervical cancer. While it's true that HPV is a sexually transmitted infection, recent research suggests its impact on health extends far beyond the realm of sexual health. New findings indicate a potential connection between HPV and an increased risk of cardiovascular disease. This discovery underscores the importance of understanding HPV's broader health implications. HPV is a diverse virus with over 200 known strains. Some strains are considered high risk due to their association with cancer. Other strains are considered low risk and are often associated with genital warts. While the link between high-risk HPV strains and certain cancers is well established, the potential for HPV to influence cardiovascular health is only beginning to be explored. The revelation that HPV may play a role in heart health opens up a new dimension in our understanding of this common virus. This is particularly significant given HPV's prevalence, affecting millions of people worldwide. As researchers delve deeper into this potential connection, it could have significant implications for public health strategies and preventive care. Recent studies have unveiled an alarming trend, a possible association between HPV infection and a heightened risk of cardiovascular disease. One study, presented at the American College of Cardiology's annual scientific session, analyzed data from 7 studies conducted between 2011 and 2024. This comprehensive analysis involved nearly 250,000 patients and yielded concerning results. The study found that individuals who tested positive for HPV were 40% more likely to develop cardiovascular disease. Even after adjusting for other factors that could contribute to heart disease, such as age, smoking history, and underlying health conditions, the risk remained significantly elevated at 33%. Perhaps even more alarming was the finding that HPV-positive individuals face double the risk of coronary artery disease, a serious condition affecting the blood vessels supplying the heart. These findings suggest that HPV infection may be an independent risk factor for heart disease, on par with more traditional risk factors like high blood pressure and cholesterol. These statistics paint a concerning picture, highlighting the potential for HPV to impact the cardiovascular system in ways we are just beginning to understand. While the exact mechanism linking HPV to cardiovascular disease remains unclear, scientists are exploring several possibilities. One prominent theory centers around the role of chronic inflammation. When the body is infected with a virus like HPV, it triggers an inflammatory response to fight off the invader. Persistent inflammation, however, can have detrimental effects on the body, including the cardiovascular system. Chronic inflammation is known to contribute to the development of atherosclerosis, a condition in which plaque builds up inside the arteries. Over time, this buildup can narrow the arteries, restricting blood flow and increasing the risk of heart attack and stroke. Some researchers speculate that HPV infection, particularly with high-risk strains, may trigger a chronic inflammatory state that contributes to atherosclerosis and other cardiovascular problems. This theory is supported by a 2024 study published in the European Heart Journal, which found that women with high-risk HPV were 4 times more likely to die from heart disease. While more research is needed to confirm this link, the potential role of inflammation underscores the need to address HPV infection as a multifaceted health concern. Support HPV research and share this video to raise awareness. Together, we can make a difference. The potential link between HPV and cardiovascular disease is a relatively new area of research. While the findings from recent studies are concerning, it's important to note that more research is needed to fully understand the nature of this relationship. Continued investigation is crucial for several reasons. Firstly, it's important to confirm the initial findings linking HPV to heart disease, and to determine if this association holds true across diverse populations. Secondly, researchers need to unravel the precise biological mechanisms by which HPV might contribute to cardiovascular problems. Understanding these mechanisms could lead to new diagnostic tools and treatment strategies. Finally, it's crucial to investigate whether the HPV vaccine, currently recommended to protect against certain cancers, might also offer protection against heart disease. Answering these questions is paramount to developing comprehensive public health strategies and ensuring that individuals are fully informed about the potential risks associated with HPV infection.